For at least 30 minutes a day, why should you walk or jog? According to some research paper, sitting for 8 hours is the equivalent of smoking one pack of cigarette. Here is Dr. Joe. A study on smoking one pack of cigarette may be exaggerated a bit. There is a correlation between spinal disc diffusion level and how your disc receive oxygen and nutrient. I will explain how it all relates. It used to be believed that disc degeneration is just a result of aging. In this world, nothing just happened. Older people tend to have problem with disc tissue from a demographic perspective. As a clinician, I disagree with it on individual level. Healthy discs are common among elderly. Contrary to popular belief, lots of younger generations suffer from serious degeneration. Even teenagers can suffer from disc protrusion, degeneration, or sequestration, you name it. Why is there such a big difference between individuals as far as disc health? It is because of characteristic of spinal disc tissue. Just like other tissue, human spinal disc needs some work to be healthy. Intervertebral disc has to pass through unique developmental changes. It starts when you are in your mother's womb. When you were in your mother's belly, the disc was fully vascularized, just like other type of tissue in our body. After the delivery, the vascular supply to the disc begins to disappear. The blood supply to the spinal disc tissue has almost completely disappeared by the time around age of 8. Then you can make logical question. Since all the discs in our body lack a direct blood supply, do they die? It is common sense that no oxygen and nutrient will lead to tissue death. Thankfully, the answer is no. Since there's no direct blood supply, they have a different way to get oxygen and nutrient. Imbibition is the way. It will create low pressure and high pressure alternatively. Diffusionary environment is created by up and down motion. This is the way our disc tissue breathe and get nutrient. So how do we create this imbibition? Just walk. Walking is pumping action, up and down motion. That's right. This type of exercise includes walking, jogging, and running. As you guys know, these are fundamental human movement. Imbibition action will feed oxygen and nutrient to disc tissue. But what if the disc tissue keeps degenerating, even with the normal exercise that I mentioned? What is cause? The answer is vertebral subluxation. If the spinal segment from C2 to L5 are subluxated by mechanical force, mental stress, or chemical damage, unstable spinal segments will be subluxated. The subluxated spinal segment can become stuck in certain position. God only knows why our spine is designed like this. This subluxation will stop normal imbibition action, which means no pumping action, limited nutrient and oxygen. If this is the case, your disc is suffocating. This is how degeneration happens to our disc. Over time, a subluxation can cause degenerative disc or joint disease. So what is the answer? Correct spinal subluxation. After that, normalize spinal imbibition through normal human movement. Then strengthen surrounding muscles. So the segment will be stabilized by muscle and ligaments. Find a qualified chiropractor and fix your subluxation and make your body strong again. Allow your body a chance to break the vicious cycle.